Welcome everyone to the Alternative Treatment of Dry Eyes webinar. This is Dr. Edward Kondrot, and I welcome you, and I appreciate you taking time to join me for this webinar, and I look forward to sharing with you valuable information that can help improve your symptoms and, in some cases, even cure your dry eyes. Have you been told nothing can be done to improve your dry eyes? You need to take drops the rest of your life. There is no cure for dry eyes. Well, I really want you to learn these valuable points that can turn your dry eye condition around. So let's begin by talking a little bit about what exactly is dry eyes. First, we have to look at where do tears come from. And this is a view of the eye. And most of the tears come from this area here. It's called the lacrimal gland. That's where the aqueous component of the tears come from. But also the eyelid and the conjunctiva also contribute to tears. The tear film is fairly complicated, and it has three layers. The innermost is a mucus layer, and that comes from the conjunctiva, or the white part of the eye, and also certain cells from the cornea produce this mucus layer. There's the middle aqueous layer, and that's secreted by the large main lacrimal gland. And then we have the lipid layer, which is secreted by the meibomian glands, which are located in the eyelids. And here's a cross-section here of the tear film, the lipid layer, the aqueous layer, and the mucin layer. Now, there is dangers of LASIK and PRK. These are all refractive surgeries. There's a percentage of people that develop severe dry eyes after these procedures, and these surgical procedures destroy the innermost mucus layer that is secreted by the conjunctiva and cornea, and this can lead to disruption of the tear film, and this leads to symptoms of dry eyes after these surgical procedures. A common question that patients ask me: why is watery eyes a symptom of dry eyes? That's kind of strange. If your eyes are dry, why are they watery? Well, it's the poor quality of tears that don't protect the eye, and the body reacts by making more poor quality tears, and so therefore then you get watering eyes of a very poor quality tear. Typically, when we diagnose dry eye, we do something called a Schirmer's test, where we put litmus paper in the bottom of the eyelids, and we measure the tear secretion. Typically, anything greater than 10 is normal, less than 10, less than 5, and especially if you have 1 or 2 or 0, that's the diagnosis of severe dry eyes. And this is a good test to monitor the treatment that you undergo. And I have observed in folks that do the alternative treatments, they will see an improvement of their Schirmer's test. So this is a nice objective measurement to measure your progression of treatment. One thing that we can all do if we have dry eyes is increase humidity. A humidifier or a water basin near a heater are some tricks to increase the humidity. Because if you're living in a dry environment, the low humidity will kind of pull moisture from your eye and make your dry eye symptoms worse. I know when I lived in Pennsylvania and we had the really cold, dry winters, I would often put a water pot right at the bottom of the radiator. And I was online and I saw this clever device that actually hangs on a radiator. So the number one thing to do is probably get some whole house humidifier, which will help improve the humidity, or you can take a shortcut and just get a water basin, put it near the radiator or the forced air vent to help increase your humidity. Now, the tears have some functions. First of all, they smooth and lubricate the front surface of the eye, and they protect the eye from foreign materials. So when dirt and dust gets into your eye, the tears will clean this area and prevent infection and damage. The tears also supply oxygen and nutrients to the cornea, which is important for the function of the eye. and they have a bacterial static function. What does this mean, Dr. Kondrot? Well, this bacteriostatic function prevents the growth of bacteria. You know, our bodies are constantly being exposed to bacteria and organisms, so the tears actually protect the eye from the growth of bacteria. Now, there is a condition called Blepharitis. This is inflammation of the eyelashes, and this is commonly associated with dry eyes. Because you're not making enough of these bacteriostatic tears, what happens then, the bacteria begins to grow on the eyelashes. And then this can aggravate the dry eyes because the bacteria will spill toxins into the eye, which cause redness and burning. So this is a vicious cycle, dry eyes and blepharitis. So in many cases, we have to treat both conditions. We got to treat the blepharitis and we got to treat the dry eyes. One way of treating the blepharitis is good lid hygiene, and often we recommend lid scrubs, getting a small cloth, a washcloth, and scrubbing the eyelids, hot compresses, keeping these eyelids clean. In some cases, we recommend a very weak solution of baby shampoo to help break up the oils and debris on the eyelashes. But good lid hygiene can be very helpful in treating the symptoms of dry eyes. We all know that there's problems with our healthcare system. Often doctors are not the ones to make the decisions regarding your healthcare. We have the pharmaceutical industry, which is influencing patients and physicians. We have the insurance companies, which are kind of pulling the strings and telling doctors what to do. And of course, we have the political system. So I wear two hats. I'm a board certified ophthalmologist. I know traditional ophthalmology, and I'm also an alternative doctor. So my approach has always been what is going to be best for the patient, whether it's alternative or traditional care. But in most situations, I advise patients to look at the alternative treatment first. It tends to be safer, less toxic, more effective, and it looks at treating the underlying cause of disease. Traditional dry eye treatment uses lubricating or artificial tear drops. Now, these are not bad, but unfortunately, these lubricating drops and artificial tears do have preservatives, thimerosal, which has mercury, and so in some cases, allergies can develop to these artificial lubricating drops, and we have to worry about the toxins that the preservatives contain. A big no-no in my mind is Restasis, and this seems to be marketed very, very heavily, and I'll talk a little bit about that. I would advise you not to use Restasis if you have dry eyes. And of course, we have surgical options. Surgical options should be the last resort, but in some cases, surgery is necessary. The dangers of Restasis. Restasis is cyclosporin. It's a powerful immunosuppressive agent. And this goes against the laws, the homeopathic laws of healing. What do I mean by that? Well, in homeopathy, we believe that the body has the ability to heal itself. If you set up the right environment, the body will heal itself. Unfortunately, Restasis doesn't set up the right environment. It's suppressive. It just reduces inflammation, and in the long term, it can actually cause more problems with the eye. In fact, Allergan, the company that manufactures Restasis, reports that 17% of patients will have burning, stinging, and tearing as a side effect. And this boggles my mind because these are the very symptoms that we're treating in dry eye. So 17% of the patients will get these symptoms. Now, serious side effects can occur with Restasis, including hives, trouble breathing, chest tightening, swelling of the mouth, swelling of the lips, swelling of the face and tongue, and also worsening of the dry eye symptoms. So my advice is if you've been recommended to take Restasis, avoid it. Try the alternative treatments that I'm going to suggest first. We also have the surgical treatment of dry eyes, and this is conducted by blocking the drainage duct. the tears are produced, and then they leave the eye. This is kind of like the drainage duct where the tears go into these cannulas, and then they drain into the nose. By putting a small plug, we block the drainage duct, and the tears that your body are making will stay around for a longer period of time. This is something that I also do not recommend unless you have severe dry eyes and alternative treatments are not successful. So my conversion to alternative therapies, I practiced traditional ophthalmology for over 20 years, and when homeopathy cured my severe case of asthma, I began looking at alternative treatments, and I've been integrating alternative therapies since 1990. Okay, so let's roll up our sleeves and let's talk about things that can be done to help our dry eye symptoms. Number one, I'm a big advocate of an organic raw diet. We call this our 70-30 diet, that 70% of your diet should be organic, raw, or living food. Now, why organic? There was an interesting study done in the early 40s where they looked at the average serving of spinach. The average serving of spinach had 158 milligrams of iron. That study was repeated in the year 2010, and the average serving of spinach, non-organic, revealed it only had 2.2 milligrams of iron. My goodness, it went from 158 down to 2.2. Why did this occur? Well, our farming techniques have changed. We now have commercial farms that are non-organic. They're using pesticides, preservatives, and our soil is being depleted. There was a study done in Chicago that compared organic and non-organic fruits and vegetables, and across the board, the organic had 5 to 10-fold more nutrition than the non-organic, and 5 to 10-fold less toxic metals. So there's two reasons to go organic. One, you're getting more nutrition, and you're getting less toxins. And if your body is going to heal itself, you got to have the basic building blocks. You got to eat organic. Another shocking discovery I came across is that fish oils might be contributing to your eye problems and blindness. And this was hard for me to accept because I was indoctrinated in medical school that fish oils are great for the body. When I first heard Professor Peskin speak at a meeting, I thought he was crazy when he made this comment. And then I discovered that my good friend, Dr. Robert Rowan, who's the editor of Second Opinion, has investigated Dr. Peskin's work, and he feels strongly that Dr. Peskin is correct. And Dr. Rowan is no longer recommending fish oils for his patients. So my advice is stop taking fish oils and begin taking plant-based omega products. And some of you may be more interested in learning more about this. This is a publication you may want to read about, written by Professor Peskin. And also I have available an audio interview that I had with Professor Peskin explaining the dangers of fish oil. But basically, there are three reasons why you should avoid fish oils. One, they're longer chain fatty acids that are not absorbed by the cells, and in high dosages they can actually be toxic to the cells. Also, fish oils become rancid at room temperatures. When these oils become rancid, they're toxic to the body. And the last comment is that we are concerned about the mercury in fish oils. And even though the manufacturing companies say they're mercury-free, I don't believe it. I still feel that there's probably small traces of mercury. So I'm not saying that you should avoid all oils. I'm saying avoid fish oils and go more towards plant-based products, plant-based omega oils. Another shocking discovery is that the majority of patients that I see are deficient in zinc. In fact, 80% of patients are deficient in this even if they're taking zinc as a supplement. Why is this important? Well, zinc is an essential mineral for just about every enzymatic reaction in the body. There have been many studies done to show that zinc deficiency is linked to eye diseases. So we have to have a proper zinc level. There is a simple zinc taste test that I do routinely with all of my patients to determine if they're zinc deficient. And then we get them started on the proper vitamins. And later I'm going to talk about the vitamin line I designed that will help treat this zinc deficiency. Proper hydration makes sense, especially if you have dry eyes. If your body's dehydrated, my goodness, you're not going to be able to make the proper amount of tears. So you've got to drink the right amount of water. A great book written by Dr. Batmanjaldi, he states that many cases of chronic disease are cured just by drinking enough water. So we recommend you drink half of your body weight in ounces of water. So if you weigh 140 pounds, you're drinking 70 ounces of water. But the big problem is, where are we going to find a good source of water? Well, we know that there's dangers in public water, and now pharmaceutical compounds have been now discovered in public water. And we know about the dangers of plastic bottles. We used to think that bottled water was safe, and now we're finding that plastic derivatives, phthalates, and benzene derivatives are found in the water. So we need to find a good source of water. So unless you have a spring or a well in your backyard that's been tested, I believe one of the best mechanisms is getting a reverse osmosis system. These are simple systems that go underneath your kitchen counter, and they will process the water, purify the water, much like distilled water. So you will get a good source of water. And these can be found at many hardware stores, Home Depot, Lowe's, and I would encourage all of you to begin drinking a good source of water, because if you're drinking contaminated water, it's not helping you and it's contributing to the problem. Balancing the autonomic nervous system is important. Our body has something called the fight or flight, and the body will not heal in a sympathetic state, or the fight or flight. When the grizzly bear's chasing you in the woods, certain physiological changes take place. Your blood pressure increases, your heart rate increases, your pupil dilate, your digestive system slows, and your body will not heal itself. The healing process is slow. So we have to reduce our stress. Ways to reduce stress: physical exercise, meditation, prayer, positive affirmations. And we've developed microcurrent stress therapies and light therapies, which can be helpful. One of my favorite eye doctors is Dr. William Bates. He was a turn-of-the-century ophthalmologist who felt that all eye disease was due to stress. And he developed a series of exercises. I would encourage you to investigate Dr. Bates and do some additional reading on him. I first thought Dr. Bates was crazy, and then I read a book written by Aldous Huxley, who's the great science fiction writer. Huxley had very poor vision, and he struggled. He went to different clinics throughout the United States, and no one could help him. Then he discovered Dr. Bates, began doing these exercises, and cured himself of his visual problems. And Huxley was so grateful to Dr. Bates, he wrote a book called The Art of Seeing. And this is a good summary of the work of Dr. Bates. But anyway, palming and blinking are two components of the Bates exercise. Palming is very simple. You put the palms of your hands over your eyes, and this helps your eyes to relax. Dr. Bates also talked about the importance of blinking. When you're in a stressful situation, you stop blinking. By blinking, you're increasing the lubrication of the front surface of the cornea. You're also relaxing your eyes. So blinking is essential. Next, I want to talk about Syntonic light therapy. This is a wonderful form of treatment that was developed by the College of Syntonics. This is a 70-year-old organization of eye doctors that use light therapy. Light therapy can be very powerful in reducing inflammation, stimulating healing, and increasing tear production. So the light therapy can reduce inflammation, stimulate cellular activity, and help detoxify the eye. And all three of these things can be helpful for dry eye. And here are two patients doing some light therapy in the office. We have specialized glasses that put a specific wavelength of light into the eye. And this is a home unit where we have a gooseneck lamp, and sitting there with these glasses, you'll get the light therapy. Now, many of you may be thinking, now how can light therapy possibly help? Well, there's been a lot of research on light therapy, and many of you have heard of cold lasers. Lasers are the hot topic now. Dr. Tina Karu, a brilliant Russian researcher, wrote a book on light therapy, and she feels, and she's done research to demonstrate that certain wavelengths of light will stimulate cellular activity. And she's identified this in the electron transport chain, in changes in the cytochrome C activity. So there is some good scientific evidence that light therapy does have a profound effect on the cellular level. And so this has always been a big part of our practice. Homeopathy is what got me started in alternative therapies. And I have a question for all of you. Who was the first homeopath? And many of you who have studied homeopathy may be saying Samuel Hahnemann. Well, Samuel Hahnemann did develop the present system of homeopathy, but the first homeopath was actually Moses. And this is written in the Bible, Exodus 23:20. And he took the calf which he had made and burnt it in the fire and ground it into powder, stewed it upon the water, and made the children of Israel drink that. And this is how we make our homeopathic remedies. We burn it, we grind it, and we put it in water, and we make a solution. And it's interesting, the calf was made of gold, and we use gold as a homeopathic remedy. And it's interesting, gold is used to treat depression and despair. And at this time of the history of Israel, there was a lot of despair because they were wandering around the desert for so many years. And so Moses was the first homeopath. Homeopathy is based on the law of similars. So a substance that causes a symptom in a healthy person will cure this symptom in a disease state. In homeopathy, we believe the body has a wisdom. So when the body produces symptoms or a disease, it's necessary for the body to achieve homeostasis. So, for example, if you have a fever, it's necessary for the body to have a fever because the body is trying to maintain homeostasis or balance. Maybe the fever is necessary to get rid of some toxins. The same thing with diarrhea. If the body has diarrhea, then it's necessary to maintain homeostasis. So in homeopathy, we respect this wisdom of the body, and then we actually prescribe homeopathic remedies that cause the same symptom. So belladonna produces a fever, redness of the face, and throbbing. So if a patient would come in with redness of their face, fever, and throbbing, we would actually give them homeopathic belladonna. So these are some common homeopathic remedies. The onion, Allium sepia, and when you peel an onion, you get watering of your eyes, right? Well, in homeopathy, we give dilute concentrations of Allium sepia to treat watering of the eyes. A bumblebee, when you get stung by a bee, you get a lot of burning and redness. So if the eye has burning and redness, we treat that with a homeopathic Apis mellifica, which is the bumblebee. And this is a rattlesnake. The rattlesnake, when you're bit by a rattlesnake, you get hemorrhage and swelling. So in the eye, if you have hemorrhage and swelling, we would treat you with the rattlesnake or Crotalus horridus. The other thing I like about homeopathy, it looks not only at your eye problem, but it looks at other diseases, physical problems, and your mental and emotional state. So we like to put all this together before prescribing a homeopathic remedy. Now, a big part of the treatment of dry eyes are these homeopathic remedies. I've developed a homeopathic allergy drop, and this contains micro dilutions of ingredients which are known to cause allergies. So it kind of works in a way by desensitizing the body. You know, when you're allergic to ragweed and you go to the doctor, what does he do? He gives you micro dilutions of ragweed. So this is kind of like the homeopathic approach. We've also developed two very interesting dry eye homeopathic drops. One is for men and one is for women. There's a distinct difference between men and women, and based on homeopathic principles, we developed this unique line of homeopathic products for men and for women. I'd like to talk a little bit about microcurrent and its potential application in the treatment of dry eyes. Well, let me just back up here. I became interested in microcurrent when I first read an article about the great golfer Sam Snead curing his visual problem with microcurrent. I had the pleasure of treating the late Sam Snead. This is a photograph of me working with him. And in exchange for me treating him, he gave me golf lessons. I'm pleased to say that my treatments did help his eyes, but Sam told me nothing is going to help your golf game, Dr. Kondrot, and he was right. He was right. So what are the mechanisms of microcurrent? Well, there are many published articles in the medical literature that show that microcurrent improves blood flow. It also stimulates cellular activity. It can reduce or remove scar tissue, reduces inflammation, and has a neuroprotective effect. So microcurrent does many things. And here's Lance Armstrong, his cycling team, when they won 7 Tour de France's, routinely used microcurrent to reduce swelling and injury and help regenerate their body. Here's a photograph of myself and my wife. We recently did the Marine Corps Marathon, and our bodies were aching. We were really disabled after the race. This is a 26.2-mile race, and one microcurrent treatment, it was amazing. It just took away all our pain and aches and just rejuvenated us. So how does microcurrent work? Well, microcurrent is a very, very low current of electricity. We deal with a microamp. A microamp is a millionth of an amp. And this electrical current gently stimulates the body at the cellular level. Another way that microcurrent works is that each tissue has a unique frequency or vibration. So what we want to do is we want to match the resonance of this microcurrent frequency with the tissue. So when we're treating the eye or the cornea or the tear film, we're programming the machine with a specific frequency that vibrates or supports that particular part of the eye. And in music, if you have 2 C tuning forks and they're vibrating the same way, they support each other and there's harmony. So likewise, when we're treating the eye, we're trying to harmonize the microcurrent frequency with the tissue, to harmonize it, to give the tissue support to help with regeneration healing. And there's an example of the machine that we're using by Inspirstar, and this is an eye treatment on the right. We have these electroconductive gloves, these electroconductive gloves that are put into a washcloth, and then they're placed over the eye so the current is gently administered to the eyes. We also have body treatments in microcurrent in addition to the eye treatments. On the left is a stress reduction treatment and detox, and you can also do the stress program just simply by holding the gloves. And I mentioned earlier how important it is to detoxify the body and how important it is to reduce the stress in the autonomic nervous system to help the body to heal. Now, microcurrent in the treatment of dry eyes, well, it reduces inflammation, which is essential to help improve the healing of the eye. It also detoxifies the eye, and I have observed it actually stimulates tear production. I have treated many dry eye patients, and immediately after their microcurrent treatment, we see an increase in the Schirmer tear production. Now, I'm really happy to announce to you folks that I have been invited to participate in a microcurrent research project at the University of Rome. There are 2 professors, Professor Matteo Russo and Marcello Nebbioso, who are interested in studying the studying the effects of microcurrent on the eye. And they've developed a research model, an animal model of macular degeneration, and I'm going to be in charge of a study looking at the effects of microcurrent on this animal model. This is very exciting for me, but I just want to reassure my patients and those of you that are listening, I am not closing my office. I am not moving to Rome permanently. I am still going to have my office open. I'm still going to be conducting my 3-day programs, my webinars, and I'm still going to be doing consults. I plan to return back to the United States every 2 to 3 months, and most of my work is based on telephone consultations, so this will still be conducted while I'm in Rome. And here's a photograph of me and Professor Matteo, and I look forward to reporting back to you on my research work in Rome. Next, I want to talk about really an exciting discovery that I have found to help folks with dry eye, and these are ozone eye drops. Ozone is a highly reactive form of oxygen. Ozone stimulates regeneration, and it also acts as a disinfectant. I know many of you, when you think of ozone, you think of the ozone layer and the toxic effects of this. But ozone can be toxic if you breathe it, but in solution. And doctors give ozone IV, intravenously. It's a highly reactive form of oxygen, and it helps with regeneration of the body and stimulates healing. And ozone has been used for probably over 50 years for helping regeneration, and there are many articles written on that, but it's exciting that now ozone eye drops seem to be very effective in treating dry eyes and Chelation. Making ozone eye drops, you need a preservative-free saline, you need a home ozonator, and you can call the office at 800-430-9328 to get information on that. And you need to make these eye drops every day because, unfortunately, the ozone is highly reactive and it only lasts 12 to 24 hours. So here's an example of an ozone generator being used. We recommend you use a glass container with normal saline. It's critical that you use preservative-free saline. Saline that has preservatives is a no-no because the preservatives will react with the ozone and produce toxic products. You can buy preservative-free contact lens solution and use that. So we ozonate the water. This is an ozone generator, and this is like a little aquarium bubbler. And then we put them in an eye drop bottle, and you use the drops every 15 minutes or so. And like I said, they only last 12 to 24 hours, so you have to remake the ozone drops every day. But this has been a godsend for many patients who have severe dry eyes. We also look at heavy metals. Heavy metals can be a contributing factor in all chronic eye disease, and I recommend that you test the heavy metals by a 6-hour urine challenge test. And this is interesting because you could be dying of heavy metal poisoning and your urine will be free from lead. Your blood could be free from lead if you're dying of heavy metal poisoning. Why? Because these heavy metals go into your bone, they go into fat, they go into neurological tissue in your eye. They just don't stay in your urine and blood. So you need to take something to draw out the heavy metals, and this is a chelating agent. Chelating agent is something that makes these heavy metals soluble. So before you do the heavy metal test, you take this chelating agent, and then the heavy metals become soluble, and then we measure them in your urine. And there's an example of a patient that had the 6-hour urine challenge test, and it shows here the lead is elevated. So then, once we identify the heavy metal, we'll begin some type of treatment program for you. Typically, the programs consist of chelation therapies. Chelation is a very large molecule that binds the heavy metals, makes these heavy metals soluble. There's 4 mechanisms or 4 ways of doing chelation. The best is intravenous, second rectal, chelation topical and oral, and it's important you consult with an alternative doctor once you identify what heavy metals are elevated so we can develop a program to help you reduce these heavy metals. Also, hormonal imbalances may be related to dry eye. There are many more females than men who have dry eyes, and it is related to estrogen levels. Typically, dry eyes develop in females after menopause. So if you are female and you do have severe dry eyes, you should have your estrogen levels investigated, and you may consider then working with the naturopathic doctors to take the vitamins, minerals, and nutrients to help bring your estrogen levels up to a functioning level, and in some cases, hormone replacement therapy may be necessary. But most naturopathic doctors first recommend a nutritional approach to try to increase the estrogen levels, and then consider hormone replacement therapy. Also, low thyroid is related to dry eyes. So if you have a cold body temperature and you have symptoms of low thyroid, this should be investigated. So let's summarize the treatment for dry eyes. Number one, keep your eyelids clean. This can be very helpful. And sometimes if you have marginal dry eyes, just simply keeping your eyes clean can relieve your symptoms and make your eyes healthy. Increase humidity, especially those of you living in the north. The dry, cold winters can be really devastating. And of course, we have a lot of problems here in Phoenix, Arizona with the dry humidity. So increasing the humidity. Blink and rest your eyes. Frequent blinking can be helpful. Get out of that sympathetic state. When you're in the sympathetic state, you stop blinking. Rest your eyes. Close your eyes. Consider doing palming. I also recommend you begin the homeopathic eye drops that we recommended, either the dry eye drops for men or the dry eye drops for women. And you know who you are, and you know what you should order. Proper diet and hydration is essential. I can't emphasize how important proper diet is. Shift your diet more towards organic, raw living food. Raw living is important because as soon as we cook, steam, boil, the delicate protein structures are destroyed and the food loses its nutritional value. Hydration, I mentioned, is critical. If you have dry eyes, you've got to have enough water in your body. Hydration is also essential to remove toxins from your body. If you're dehydrated, toxins are going to accumulate. Also consider vitamins, and the main vitamin that I recommend is the plant-based omega products. Try to avoid fish oils. Over the years, I've developed some vitamin protocols. I have a vitamin protocol for macular degeneration, glaucoma, cataracts, but right now we're going to just focus on the dry eye vitamin protocol. It's a very simple protocol. We have the specific homeopathic drops, either for men or for women. I also have an ocular function spray. This is a liquid vitamin that has a lot of key nutritional ingredients that you spray under your tongue. These are quickly absorbed by the body because one of the biggest problems I think folks have is they might be taking good vitamins, but they're poorly absorbed. So the ocular function spray is great because this is quickly absorbed into your body through the tiny capillaries under your tongue. And we recommend the Yes plant-based omega products. And this is, I think, a much better alternative than fish oils. If you are taking fish oils, I would consider trying these products for 3 months and seeing if you have an improvement of your dry eyes. And we have a special webinar deal that if you order the entire protocol, you'll save 20%. And you can go to this link to order the protocol, or you can call us for more information. And those of you that are participating in the webinar, I will be sending you a copy of all the slides so you can review this material. Okay, we talked about the primary treatment. Now let's go to the second level treatment. This is where you can begin using ozone eye drops. So if you're doing the primary treatment for 3 months and your dry eyes still have not improved, you're changing your diet, you're taking the homeopathic eye drops, you're taking the Yes plant-based omega, you're cleaning your eyelids, you're blinking, you're reducing stress. If it's still not helping you, this is the second level treatment. Begin using the ozone eye drops. And if you're interested in buying an ozonating machine, give the office a call at 800-430-9328. The ozone machine is fairly inexpensive. It's only $140. We have a professional ozone machine in our office that we paid over $3,000 for, and we investigated various machines on the market, and I think we have a good functional machine that can be used at home. Have your heavy metals tested. We can do this. If you're interested, we can send you the 6-hour urine test. This test can be done at home, and then we'll evaluate the results and determine whether or not you need some additional treatment. Also have your estrogen levels and thyroid evaluated. So this is all part of the second level treatment. The third level treatment is when you actually begin some of these specialized treatments. These include microcurrent, light therapy, and homeopathy. Now, most of these treatments are conducted during our 3-day programs. And the indications for considering these 3-day programs is if you have severe dry eyes not responsive to the previous treatments, or if you have dry eyes with macular degeneration, dry eyes with glaucoma, or dry eyes with cataracts. This requires a more intensive treatment because you have more than just dry eyes. There is evidence of other more serious damage to your body, and I would recommend considering our 3-day program. We have 2 programs to choose. One is our traditional 3-day in-office program, but I'm really excited to announce our Fast Track at-home program. Now, the Fast Track program, to begin microcurrent, there's no need to travel. It's home-based, a 3-module program. It's computer webinar-based, and because you'll be saving traveling costs, hotel accommodations, you'll be able to achieve a large discount. Module 1 is you'll send us a copy of your eye records and OCT. OCT is ocular coherence tomography. This is a specialized picture that the doctor takes of your retina. Once we receive your eye records and the OCT, you'll have a personal consultation with me. I'll review your eye records, your OCT, and we'll discuss your goals and whether or not you're a good candidate for the program. You'll also receive a lecture on nutrition and vitamins for your eye. This is a very comprehensive lecture. It's on DVD, audio, CD, and print for you to review, and also will help you find a doctor near you for intravenous IV therapies if needed. Also, you'll be given a zinc test case. You'll take this test, and we'll determine if you're deficient in zinc and what steps should be taken to get your zinc up to a functional level. Module 2 is hydration, detoxification, and chelation. You'll be educated on these 3 items, and it'll also be DVD, audio, and print, and you will be getting a 6-hour urine for heavy metals during Module 3, or Module 2. Module 3 is your introduction to microcurrent, how to use your microcurrent machine. We'll talk about light therapy, ways to improve your results. Once you complete the 3 modules, then you'll be sent your personalized microcurrent and light treatment machine to use. Now, the 3-day in-office program includes all of the Fast Track, plus you'll have a personalized homeopathic evaluation with me. You'll receive a Mars nutritional IV in the office and daily oxidative therapies. You'll receive 1 IV therapy a day. You also receive in-office microcurrent and light therapies. You'll be getting 2 to 3 microcurrent treatments and 2 to 3 light therapies every day. You'll also be getting hyperbaric oxygen and other treatments because you can see that the in-office program is much more intensive. Now, the 3-day in-office program is roughly $6,200, although most patients will find that it's less, but a lot depends on your health and your particular needs. There is a money-back guarantee for all services. At the end of the 3 days, if you don't have improvement of your vision, at the end of the 3 days, we'll refund all your money. And we also give you 1 year of continued support. The Fast Track program is $3,950, and we also have a 30-day money-back guaranteed for any reason. If you find that you don't like the microcurrent, it's not helping your eyes, we'll refund all of your money. Also, the full value of the Fast Track fee can be used to upgrade to the in-office 3-day program. Many patients go through the Fast Track program, have good results, and then they want to come to our 3-day program to obtain more intensive treatments to help improve their vision. Also, the Fast Track program includes 6 months of continued care. So the next step is to decide what program is best for you. And once again, most of you out there with the dry eyes are just going to be satisfied with utilizing the information that I reviewed with you, and the Fast Track program may not be necessary for you. But if you do have serious dry eyes, not responsive to the treatments, or if you have dry eyes, macular degeneration, glaucoma, and cataracts, you do need more intensive treatment. So if you're not sure what program is best for you, you can attend the Intro to Dr. Kondrot's program. This is a free webinar which I review in detail the difference between the two programs, or you can call the office or email us with more information. So beginning these programs is as simple as 1, 2, 3. You register online and pay a refundable $500 deposit, and there's the link to register. You fax the records to 623-505-2466, and then once I receive your eye records, we'll schedule a consultation within 24 hours. And this registration fee is refundable. If for some reason after the consultation I feel you're not a candidate or you feel the program is not for you, we will refund your $500. I also invite you to join me. Every Sunday I have a radio show called Healthy Vision Talk Radio. It's 5 to 6 p.m. Arizona time. You can listen online at 1100 KFNX, and you can go to my website to find out the list of scheduled guests. I try to schedule very interesting guests, doctors who are doing alternative treatments, and your questions are always welcome. So please join me every Sunday. I've written 2 best-selling books, Healing the Eye the Natural Way, that explains my philosophy, and you can get a lot more information on that, and also my book, Microcurrent Stimulation, Miracle Eye Cure. I'm also excited that coming out the summer of 2012 is my new book, The 10 Essentials to Save Your Eyesight. So I look forward to working with you to help you improve your dry eye symptoms. If you do have any questions for me, you can fill in the question block right below this video, and I'll try to get back to you as soon as possible. You're also welcome to call the office for additional questions at 800-430-9328. So I want to thank all of you for listening to this webinar. This is Dr. Edward Kondrot wishing all of you good health and clear vision.